If you're new and don't know what Trickstop is, you'll find a brief description here. And also you can download the free app, Trickstop, and use it for self-monitoring. If you have a therapist and you want to work with your therapist on hair pulling, you can also use this app with them. Now let's end the poll and see what is it that you've selected for March. Okay, so was this quite a convincing victory? Working with triggers, this will be our topic in March. So this is quite interesting and quite practical and useful. So we will be talking about triggers. If you thought about any other topics, please add them into the Q&A so that I know to add them on the list for next month. Hi, Vladimir, can you share your thoughts on what we can do to help someone with TTM who pulls out of boredom rather than feeling anxious? Thank you. Yes. So first, what I would do is I would harass them with questions to define what boredom is. I often find that once you unpack what boredom is, you frequently find anxiety in it, because when people are bored, what they start doing is they start ruminating. Think about it. If we look at hair pulling as a form of experiential avoidance, why would someone escape boredom? Right? So there's something else. There are parts of your experience that you come into contact with, and then you choose not to deal with them, and then you pull. So I wouldn't entirely discount that there's no anxiety there. But if a person pulls out of boredom, the first thing I would do is, one, I would pay attention to what thoughts they have when they're bored. And then I would pay attention to what happens in their body when they're bored. That would give me a clear picture of what is it that they're trying to avoid, if we're talking about experiential avoidance, right? And then I would find a different way to deal with it and to understand it. If you were asking about practical tools, essentially any competing response would do. I have another thought on boredom, which to me is very important. If you remember in the beginning when I talked about how constructivists approach our feelings and emotions, well, if we apply that principle, to boredom, what do you think the message of boredom is? Like typically when you feel bored, what does that mean to you? Usually, and I'm generalizing, so it really may not be the same for everyone since we all have different experiences, but usually what boredom is telling us is that whatever we're doing is not stimulating us in the way in which we need that in that moment. So let's say you're watching TV and you're bored, and then you start pulling. So you're watching TV and your body is telling you that it needs a change of activity, and your choice of activity is pulling, for example. To me, this usually illustrates let's put it this way. What the first thing I think about is, why is it that you're not proactive enough to actually figure out what is it that you need and deal with that need? Why is it that pulling is better than actually dealing with your needs? Because that would mean diving deep into what you feel to figure out what you need. And most people, unfortunately, live the kinds of lives where they don't have time to sit and think and contemplate on their psychology. So understanding what you need means facing a lot of vague and uncertain symptoms. And this is where we get to anxiety, because that's exactly what anxiety is. Believe it or not, I once had a client who was so confused about sort of what the body was saying that even these basic needs like thirst or hunger were sometimes very confusing. That was the level at which this client didn't really listen to their own needs. So boredom is a signal to change activity. If someone doesn't, there's a huge question mark there. And it tells you most likely how that person relates to their own emotions and needs. Which book by Pema Chodron are your quotes from? Some are from When Things Fall Apart, and oh gosh, so the other book is upstairs, and I cannot think. I'm sorry. So most of them are from When Things Fall Apart. There's another one, but I cannot think of the name now. I'm seeing the covers in my mind, but I cannot think of the name. Sorry. So When Things Fall Apart is the main one. Will we be able to get a recording of this session? Yes. In a day or two, you will receive an email from Trickstop, and they will send you a link once it's uploaded to YouTube. what is the proportion of people with trichotillomania that also have anxiety? So anxiety disorders in one way or another are the most common problems that come along with trich. So so the second, I guess. So the most common co-occurring condition is skin picking, and then afterwards it's anxiety related issues. So a lot of people. I mean, also, even if you don't explicitly experience, panic attacks or very intense anxiety, the sort of the whole idea about avoiding facing your experiences always has anxiety there implicitly present. But on a clinical level, I would say at least 60% in my experience. But in terms of how many people will have a diagnosable anxiety disorder, that's a little less, but let's say about a third maybe. Because obviously you can be quite anxious without that being a mental disorder. That's what I'm getting at. That's the difference. How can I make these anxiety relief exercises stick, as in not forget during crisis? So just practice, practice, practice. Unfortunately, I don't have any words of wisdom for that. If you're anxious and need to apply them at specific places, post-it notes will always work. In general, like when you implement new habits, for example, when you start implementing competing responses, people find it that it's much easier to implement using squeeze toys or like worry stones and stuff like that, because you have an object that reminds you, like it's just there. Its presence is a reminder. So for these, it is easy to forget. But let's say if you do it in the bathroom and you need it in the bathroom, just put a post-it note on the mirror. You don't even have to write anything on the post-it note. The note itself will remind you to use them. So that's the only thing that comes to my mind, but it is about exercising. And whenever you're forming a new habit, you will always fail occasionally. So there's no perfect way to start and then you're 100% efficient. So every time you start, you will fail a few times. If you're talking about the exercises, the long-term ones, the ones that are supposed to be done daily, like progressive muscle relaxation or a meditation and things like this, then the easiest thing that you can do is connect them to something else that's already a habit. It's called habit stacking, because if you have one habit that's established, it's much easier to just attach another habit. So the way that I personally structure my meditation practice is that when I wake up, I have a meditation cushion right next to my bed. It's literally the first thing I do. I just slide out of bed onto my meditation cushion, and then I do my morning meditation, and then I proceed with my day. Because I realize that it's the simplest way to implement it, because it's between me and the bathroom. So it's like, it's literally on the way. But if you have a ritual like morning coffee or something like this, you can start from there, and then you can add these techniques in what's already an established ritual, because that way you're not going to forget about them, and it will be much easier to make them permanent, since you already have something to work with. Like you already have a foundation of a habit. Can we get the recording? Yeah, you will be emailed the recording. When I'm in class, I like to keep my fingers busy instead of picking at my eyelids. Are there any fidget toys you'd recommend that aren't noisy and keep my hands from subconsciously going to my face? So worry stones are small and you can basically play with them in your hands and no one will notice. But a stone is just a stone. So what you can get from it is the rubbing or just moving it around in your hands, but it doesn't do anything, obviously. So if you need a fidget toy that's more active, you can use, oh God, I don't know what is wrong with my brain today. Spinner rings. Like it's basically like a ring that you can wear on your hand that has a part that you can move and revolve. So you can play with it like this and no one will notice. So these would be okay, I think, for class. Yeah, squeeze toys could also, any stress ball would also do the job as well, except that spinner rings and worry stones are much smaller, so no one will probably notice. But I know what you mean. A lot of the fun uh, fidget toys make noise, so it's really difficult to use it in front of people. How will you send us the packet of exercises? Do we need to write our emails in the chat? So either way, I will upload them on Insight Timer, and I will also send them all to our tech support. So when they email you the recording, they will, I guess, try to attach it to the email or at least send you a link where you can download them. So you don't have to leave your email here. You signed up for the webinar, so they will email you afterwards. Usually I'm thinking they will, I'm not exactly sure when they will email you, but I will upload the recordings tomorrow, so, and send it to them. So I assume on Friday they will email all of it to you. Um, do you have any tips or techniques to disrupt the motor behavior chain when feeling anxious? Sometimes when I feel like I've been pulling for a long period of time, it's hard to snap out of it and try to be mindful or meditate. Or do you suggest people try to be proactive with these relaxation techniques? So if you're already kind of involved in pulling, if, if I don't know if that terms means anything specifically to you, but we often use the term pulling trance for those situations when you're so immersed in pulling that it's almost like the rest of the world doesn't exist. We had a whole webinar on that. If that's what you're talking about, being proactive is extremely important, because these, I mean, people didn't choose the word trance for no reason. It's not a technical term. It's a term that I actually learned from my clients. So it's a term that came from people who experience it. A trance is essentially an altered state of consciousness. So it's very hard to snap yourself out of it. Breathing exercises will do. And then in that case, you should choose the most intense ones. For example, the 4-6-8 breathing, or maybe even the alternate nostril breathing. That can be good. Or just take a shower, like literally take a cold shower. If there's someone outside, like someone you live with that you trust, they can also try to snap you out of it. But trances are extremely difficult to get out of. So being proactive about them is incredibly important. If you're just talking about sort of a more intense episode of pulling or just more intense anxiety, then breathing techniques would be a very good place to start. I don't think, like I said, I don't think meditation is the right thing to do when you're really anxious, because the difference between these exercises like breathing or progressive muscle relaxation and so on and meditation is that in meditation you don't really interfere with your experience. The goal is to observe, focus, and notice things and learn how to let go. This is why we usually practice meditation daily, and preferably when we're not terribly upset, because especially when you're getting started, it's much easier to let go when your experience is not intense. And until your focus becomes stable from regular practice, you're very likely not going to get good effects if you simply, say, okay, so I'm just going to follow my breath now while your heart is racing and you think you're going to die. It's just not practical enough. So focus on breathing exercises, for example. Stretching is also good. It looks even silly, but stretching really works quite well too. Anything that sort of helps you get that anxious energy out. I mean, personally, when I feel anxious, which I have to be honest is not that often, I'm a pretty, like, just things don't bother me very much. But when I do feel anxious, like I did in the beginning of the webinar, what I usually do is just kind of ground myself in wherever I am. Like it was the screen and the slides in that moment, because obviously I had to keep talking. I couldn't say, wait until I ground myself. But what I can do is like the 5, 4, 3, 2, 1 exercise as well. But I think they don't work for extremely intense anxiety. And also keep in mind that I've been meditating daily for over a decade. So meditation is not new to me. So maybe I have slightly better use than someone who's a newbie would have. That's my point. So if you're new, then breathing exercises. Please send both body scan and the other thing you mentioned. And thank you so much for these sessions. I find them very helpful. Well, I'm glad you find them helpful. I will try to send you as many as you can, but I think I sent some meditations in one of the previous webinars as well. And then I remember that the tech support told me that the attachments cannot be too big. So I will send you as much as they can possibly send. And you can always find me on Insight Timer. I think I haven't uploaded anything there for a long time, but I used to upload some stuff for when I used to have these group mindfulness trainings, and then I would upload it for people so that they can practice. So there's at least 10, I think, guided meditations out there. And there are people who guide meditations much better than I do. So there are a lot of good teachers out there that you can find. There's an app that I really like, especially for beginners. Let me tell you what, unfortunately, it's not a free app. Some features are available for free, but not all of them. Just one second, and I will tell you exactly what it's called right now. Yeah, it's called Meditation and Relaxation by Fitness 22. this is what the logo looks like. It's like a blue stain, if that. So the reason why I'm saying this is because they have essentially every type of meditation that I mentioned here, including progressive muscle relaxation. And they give you all of these in 3 different lengths. So you have, I think, 7-minute one, 14-minute one, and 21 minutes long. So you can slowly practice and then, do longer meditations when you're ready. And they're really nicely guided. I really like that app, and I often recommend it. So that's another alternative. Is trick somehow related to ADHD? I don't know that if there is any like fundamental causal relationship, but I see them together quite often. And I think anxiety is one thing that sort of may present a bridge. And I think they can, restlessness and lack of focus generates anxiety, and then that can provoke trick. Because if you have ADHD that's not well managed, essentially anxiety is always there because your focus is everywhere. And then the more you try, to focus yourself, the less you're successful. So that tends to generate anxiety. So that can be the key in some way. But this is just me really talking generalities because um, it, every person is different. But yes, I see the connection, and anxiety would be the bridge in my clinical experience. Thank you so much. I'm from Mexico, and I really appreciate your conference. In my country, there are no helping programs for trichotillomania, but all the information from the page helped me since 2012. Well, I'm glad that you find them useful. You can listen to all the old ones as well. So, you know, but more important than just listening, try to apply some of them, because I try to put a lot of practical stuff. I mean, I don't know if you've noticed, but there's always like an abstract psychological part in my webinars. Then there's like a practical thing that you can do. And then there's usually art as a bridge between the two, because I find that art usually is a good example for stuff. So there's always practical stuff to do. I mean, the key to change is always in doing. This is, by the way, sorry for a digression now, but this is something that I find to be very problematic with people who want to learn how to meditate. When they come to me and they say, well, teach me how to meditate, this is because they think it's going to be very easy and relaxing, whereas meditation is, it's like going to the gym for the mind. It's really very difficult. And then they will read 24 books on meditation, but they will meditate twice maybe. So it's always, in psychology, it's always about doing rather than reading. Over the last 5 years, I've had many stretches of 1 to 3 months when I've decided to stop pulling and actually accomplished it. 0 to 3 pulls a day. Some of those times have been during very anxious, anxiety-inducing times in my life. I have a hard time figuring out what triggers me. Sometimes it's boredom, sometimes it's anxiety. I've always wondered how I'm able to stop pulling for a stretch of time. It almost feels like a light switch in my brain. Have you worked with others that experience that? Yes, people will, not everyone, but it does happen very often that people will be able to stop for a couple of months, and then they usually start again. And when they stop, it's usually a sudden stop. I don't know exactly. Well, I know in constructivist terms. So in constructivism, there are types of everything. Constructivists like to classify things. So there are several types of change in constructivism. And the let's say the easiest, under quotation mark, types of change is something that Kelly used to call slot red change. It's a very ugly word, but what it means is that you go from one extreme to another. So, for example, you go from good to bad, right? You go from pulling to not pulling. And Kelly used to say this is the fastest change. So it looks very drastic, but because it's fast and because your behavior basically inverts itself. So you go to the opposite extreme compared to where you were before. But for Kelly, this is really not change at all, because in the structure of who you are as a person, nothing has changed. You just flipped things upside down, but you haven't really changed them, right? So you went from one side of a construct to another side, but you really didn't change the construct itself. So one thing about slot red is that it looks great. Like one day you can have a lot of symptoms, the next day you can have no symptoms at all. But then it's not a very stable thing. So you're very likely to go back. And then when slot red is the kind of change you induce, you just go from one side to the other. And then you kind of, like a ping pong ball, go, there and back and there and back. This is why when we do psychotherapy, we never tell people, at least when it comes to obviously pulling. I'm not talking about, I don't know, being addicted to drugs. That's obviously a completely different approach. But it doesn't work when you tell people, starting from tomorrow, you should never pick again, just stop doing it. It really doesn't work, because all you get is that kind of ping pong change. The goal is to go the middle route. This is why when we start substituting pulling with healthier habits, it's a process that is slow. And then we also have to deal with the emotional side of what pulling did. Because when you just stop, it's like when you go on a diet, but you decide not to eat anymore. You really need to eat. And this is why a diet has to be structured and planned and healthy. And the same goes for pulling, because as gross as it is for a lot of people to think, pulling does something for you. It has a function. Like in a generic sense, we talk about pulling as a way to self-soothe, or pulling as a way to establish control, or pulling as a way to deter yourself from feeling something, right? So pulling does things. And the reason why it's there is because it does things. And when you cut it off very quickly, you essentially cut yourself off from a valuable resource. So you can be without pulling for as long as you can be without the need that the pulling is fulfilling. This is why extreme diets always fail. And this is why these kinds of radical cuts also tend to fail. It's not always the case, but quite often it is. So that's why. And if you have a hard time figuring out the triggers, well, join us in March, because I'm kind of happy that this is the topic that you selected, because I like it and I think it's very practical. And I will tell you how to classify triggers. I will tell you how to deal with the triggers, and I will tell you how to understand why these things trigger you that trigger you. So I think you might benefit from coming back in March. Is competing response an example of working with triggers? No, I wouldn't say that a competing response is a way of working with triggers. I would say that a competing response is a way of working with the urge to pull. So a trigger is anything that will activate a certain behavioral pattern, let's say. It's in very general sense that's what a trigger is. So for hair pulling, a trigger would be anything that would either cause the urge to pull, or anything that would immediately get you to pull. So it's an event. Like a person can be a trigger, an object can be a trigger, a thought can be a trigger, a lot of things can be triggers. A competing response is a technique that we use to redirect the urge so that we don't do any damage. So a competing response does fundamentally several things. One, it helps you minimize damage, because instead of pulling, you do something else. And then two, it allows you a degree of control over the urge, because you get to choose how the urge is, let's say, satisfied, right? How the tension is alleviated. And then three, it just evaporated. I really don't know what is it with my brain today. Never mind. Let's keep three a mystery. But oh yeah, sorry. You're not suppressing the urge. I just remembered. So you're not suppressing the urge. Instead, you're working with the urge. Because when we use willpower to just stop, as people say, usually you have to fight the urge. And when you apply a competing response, you kind of just redirect it. So basically, you're working with the urge and you're not working against it. And this is why they're very efficient, because they're not brute force. They're slightly more sophisticated. So a competing response is essentially something you use after there has already been a trigger. Stimulus control would remove triggers, or at least make them less frequent. So an example of stimulus control would be to wear gloves or to cover mirrors, and then you cannot see your reflection, and then therefore you're not triggered. So that would be a way to deal with triggers. It's not the only way, but if we're talking about the first part of trick stop, that's what it would be. Is it possible that hair pulling is connected to an eating disorder? It's very easy for me to imagine that they can occur together, but connected as in causing one another, probably not. Can they have the same or similar causes? Then yes. Not a question, but thank you so much for this informative session. I learned a lot. I appreciate it. Well, I'm happy you learned a lot. I would have been happier if I didn't feel uh, like I'm on my way to dementia today, because I don't know why I cannot think of anything. What techniques do you recommend that could counteract cases of unfocused pulling, since pulling is unconscious? So if you're not aware of pulling as it happens, that does tend to make it more stubborn to deal with. In that case, I think stimulus control might be a better way to approach it rather than competing responses. That would mean, I don't know, wearing a hat or wearing gloves or something that would physically prevent you from pulling, or something that would prevent you from finding a hair that you pull. It doesn't have to be anything like that. Like, it's enough. I have my phone here. Like, it's enough that you just hold an object in your hand. And then that can also be a competing. It's very simple, but it can also be a competing response. Wearing finger covers can also help as well. But ultimately, I think what would be great if you did was to find a way to deepen your awareness so that you recognize when this is happening, because then you would really be able to understand what triggers you. Another problem with that kind of mindless pulling is that it's very hard to figure out what the triggers are, because you're not aware as it's happening. And when you don't understand what the triggers are, then it's very difficult to find a way to prevent them as well. And it's also very difficult to understand why you're triggered by something and what is it that pulling means in that situation. So I would definitely use stimulus control techniques, and I would most certainly try to deepen my awareness so that I can recognize the urges. Body scans are then maybe something that you can try. This is my first time. Would we be able to view the session you mentioned about emotions? We had a session, I'm not sure what month it was, but it's on our YouTube channel for sure, and you can find it. It's called Emotional Regulation. And it has a lot of techniques. If I would redo that webinar, I would put a lot less material in it because I just overstuffed it. I think I was very ambitious there. But certainly you can find a lot of practical stuff. I would like it if we could maybe have one webinar where we would discuss about sort of how to recognize emotions and how to understand emotions, like in a more specific way, not to talk about managing them, but just knowing what they are. Because I often find that when I start working with clients in TrickStop, that they have great difficulties identifying what they feel. Because one of the things that you fill out in the self-monitoring app is thoughts and emotions before you pull. And a surprising number of people have sometimes even complete inability to recognize what they feel. And then the only thing they can say is, I felt uncomfortable or stressed, which is about is it borderlines on being non-information, because it just means I was upset in some way. So I think being able to recognize your emotions is extremely important, because when you lump everything together into this soup of uncomfortable, you really cannot have a useful tool to deal with your emotions. If you think about it, guilt and sadness and anger and anxiety are all negative emotions. They're all uncomfortable and they're all stressful, but you will approach them very differently. If you're sad about something and angry at someone or anxious about something, the solution is not even remotely similar. So that's why it's important to be able to differentiate them to manage them well. How can I tackle the urge to bite and swallow pulled hairs? Well, this is a very general question, so I don't know where I would start. Basically, you always, when you start dealing with trick, regardless of whether or not you swallow or do anything with the hairs afterwards, you start with the behavioral aspects. So you do the habit reversal training, and then after that, you sort of slowly start getting into working with your emotions and trying to find a different way to relate to them. Whatever you do with hairs after you pull them is relevant psychologically and can be quite insightful to think about. But in terms of how you manage it on very basic behavioral grounds, it doesn't change treatment usually. Do you know how many participants are here? It helps to remember that I'm not alone in this problem. Uh, I'm not sure. I never pay attention. I will tell you right now. I don't know about the whole stats, but currently there's about 100 people here, and there was a little bit more before, because people come and go. So sometimes I'm surprised myself by the number of people that attend them. So currently there's about 100 people here. Um, One second, let me scroll down. I've decided not to mark questions as answered because I realize that sometimes that exposes people's names. So this is why I'm not marking questions as answered. I'm just scrolling them down. I'm a med student and preparing for an exam. I usually get trick when stressing, I assume you said. I recently told this to a psychiatrist. He said that my trick would go when I get done with exams. Is that true? He didn't sound too serious about my trick, but he suggested certainly if, yeah, so SSRIs have been shown to be mildly effective. Not all of them, but some of them, yes. But psychotherapy tends to be more effective. We also had a webinar on these kinds of studies. So it was one of the first ones that we had. So you can check it out as well. But psychotherapy in general is more effective than any medical treatment. You also have NAC, the supplement, which tends to work sometimes. But overall, psychological techniques are more efficient. And when you combine them, obviously you get something better. The reason I think why your psychiatrist said that is because trick tends to be exacerbated by stressful situations. And I remember what med school exams look like. All of them are very stressful situations. So it will definitely, once your exams are over, you're very likely to pull a lot less. And you're also very likely, maybe even to stop pulling altogether. But what you need to work on is then how you handle stress, because there will be other stressful situations in your life. I mean, my God, you're in medical school. If you think this is stressful, wait until you start working and then you become responsible for people's lives. That's even more stressful. So in the long run, what you would benefit from is implementing a certain stress management system. So I think that's what your psychiatrist meant. And for psychiatrists not to take hair pulling seriously, I don't think that he didn't take it seriously. It's just that most people, and myself included, when I started doing this, you just don't learn much about that in medical school. Like if you, I don't know what year you're in, but if you take I guess you would use synopsis of psychiatry. There's like one column about trichotillomania, and that's it. It doesn't even scratch the surface of how complex the issue is. So chances are, if your psychiatrist hasn't seen many patients with trichotillomania, he just doesn't really know the extent of the problem. But yeah, if it's stress related, otherwise I will just meander forever. So if it's stress related, then what you would benefit from is to find a way to deal with stress, because then that's the actual issue for you. Thank you from Scotland. A lot of very helpful advice. Well, you're welcome. It's very late in Scotland. It's a compliment that you stayed up. Um, how would I find the session on trans pooling? I feel I get in trans on tube date of session. So it's on our YouTube channel, and all the webinars are titled just like this. So one is called trances, pooling trances, something like that. It was, I think, in October. Don't hold me to it, but it's October or November. That was the pooling trans webinar. So if you go to our YouTube channel, you can find all the webinars there. If you wait for the recording, you will get the link to YouTube, so you can just find whatever works for you. We usually split webinars in two parts on YouTube, one for the Q&A, because a lot of people don't have the interest to listen to Q&As, and when they see a 2.5 hour long lecture on YouTube, no one's going to watch that. So we separate the webinar from the Q&A. Do these webinars always happen on the third Wednesday of the month? This is my first webinar. They happen every month, but it's not always on the third Wednesday because my schedule is not as organized as I would like to be. So usually you will receive an email from TrickStop about 2 weeks in advance or maybe more. And then we determine the date. It tends to be Wednesday, but it's not always. Thank you very much for your time. You're welcome. What are some tips and tricks that we can use to distract ourselves from pooling? Using nail polish has been very helpful, but I'm looking for more resources. So we don't want to distract ourselves from pooling. What we want to do is to redirect the urge onto something else. It may seem like I'm splitting hairs here, but I'm really not. Distracting yourself from pooling is already distracting yourself from what you feel. And then if you distract yourself from pulling, it's like a double distraction. I think it makes your psychological life very complicated. So you would benefit from implementing a basic behavioral kind of substitution, what we call a competing response, so that you can redirect the urge onto something else. Nail polish, I guess it can work. Sometimes people like wearing acrylic nails. That also tends to be a good stimulus control response as well. You can use stress, any kind of fidget toys, stress balls. You have those sensory toys that are meant for children that are on the autistic spectrum, and people tend to like them very much because the sensory aspect is sometimes quite important to pulling, like the texture of the hair. So you can find a competing response that works that way. If you need something small, like I already mentioned, worry stones would probably do a good job as well. The reason why I like worry stones is because they're very small, so you can carry them with you at all times. They can be in your pocket, around you, and they're also very inconspicuous, so you can use them in front of other people. If I'm older and the onset was sudden, should I be tested for pandas? Well, that wouldn't be my first go-to, but then I don't know. I wouldn't. I mean, if you ever suspect that there might be some sort of organic cause behind what you're doing, by all means have it tested. That this is something that we always do in mental health in general, is that we first have to eliminate um, first we have to eliminate organic causes for things before we declare something to be psychological. But then we should also be, one thing that they taught us in medical school was that when you see something running uh, and it looks like a horse, it's probably a horse, not a zebra. So, go for what's obvious and likely. In terms of, if you had a sudden onset, that can be due to a lot of things. It can be because you're adjusting to a stressful situation. It can be because you have a skin condition. It can be for many reasons. So if you want to eliminate the physical ones, sure, start with that. But just because something starts suddenly doesn't mean that it has a physical cause. How can we identify what started our trick? I'm going back to the first time I pulled, but I can't seem to figure out if there was a reason behind it. I just started pulling and never stopped ever since. Well, I think it is very exciting to do time traveling like in psychoanalysis and then go back to the beginning, and you can indeed do that. Just you cannot do it very quickly. Even in psychotherapy, when people go back to their childhood, it's never one conversation and then everything is crystal clear. So it takes a long time for people to remember these things. On a very practical level, I understand your curiosity and I share it with you, but it's not always necessary to go back and figure out what initially started it. It's helpful and it can give us a lot of good information, but it's not absolutely necessary to deal with it. What's more important to know is what the function of pulling is, because that's what maintains it. Sometimes the way our symptoms are formed is contingent on all these things that happened at the time, and they can be quite unique in terms of the circumstances and connections between them. So it's not always very useful for treatment, but what the symptom does, that's always extremely useful for treatment. And what it did then still does now. So you can identify the function of pulling by just observing your everyday experience as well. I feel like my urge to pull increases based on the textures of the strands of hair I feel. How could I deal with this? I just mentioned that there are sensory toys that you can use as competing responses. So that's one way to deal with it. And then another way would be if you don't feel the urge to pull before you touch your hair, then if you are more aware of what your hands are doing and you prevent obviously yourself from touching your hair, you're very likely to prevent not all pulling, but quite a lot. This is why I often ask people, do you first start searching for hairs or do you first feel the urge? Because we approach them then differently. Whoops. Thank you for hosting this webinar and sharing your time with us. It has been greatly helpful. Thank you again. You're welcome. I'm happy that it was useful. I just wish I wasn't uh, so forgetful today. Uh, I've been pulling for 25 years since I was a teenager. I don't even feel like it's stress related. It's more a habit of lifetime now. Any thoughts on hypnosis? So there's no evidence. So there are no studies that say that hypnosis works for hair pulling or pretty much, to my knowledge, most other things. So I'm obligated to say that because there's really no empirical evidence that it works. But it doesn't mean that it doesn't work. Over the years, I've had clients who benefited from hypnosis, although usually for a period of time. But then again, if they come to therapy, it's because it didn't work previously. So some people have benefited from it. There are no studies that say that it works for everyone. In general, if it's something that you can afford, you're willing to try, and you can give it a shot and then see if it works. I like to have evidence base for treatments because I want to know that I'm not wasting my time or anyone else's time and that I'm using stuff that works. But sometimes I know from clinical experience that there are things that simply have never been tested. Because in order to test something, you need to get funding for a study and so on. So it's not exactly like scientists can explore whatever comes to their mind. And at the same time, scientists, as brilliant as they are, can sometimes be very close-minded. So some things we will not test. I remember when I was in medical school, people used to say all kinds of horrible things about psychoanalysis. And then as I was sort of growing up on my own, I realized that those psychiatrists that are so relentlessly critical about psychoanalysis are usually those people who have never read any of it or have never experienced it. Because at the time when I was in medical school, there were no studies that showed that psychoanalysis is effective. Because psychoanalysts have a very strange relationships to evidence-based medicine, because the way they look at treatment is really considerably more complex and profound compared to simple symptom reduction. So it's hard to test. But then once they started testing psychoanalytic treatments, turns out they're quite effective. So in that sense, for a long time, there was even a stigma in psychiatry against psychoanalysis, but we now know that it works. So the fact that there's no evidence now doesn't mean that one day there will not be evidence for hypnosis. If you try it out, let me know. I would be really curious to hear about your experiences. Is trichotillomania just a BFRB disorder, or is there always some issue lying underneath, such as depression, OCD? Well, OCD is similar to body focused repetitive behaviors, and depression is obviously another condition, but there's always something underlying something else. I'm not sure I understand the question in the sense that there's always something behind depression too. It's not like depression falls from Mars and then you just kind of develop it. So there's always a cause for something. Whether or not you need to know the cause is a different thing, but there's always a cause. Every behavior that we have has a reason for it. Like I said, we don't really need to go into details for every one of it, but everything's caused by something. In our bodies and in our minds, nothing is accidental. Things can be very complex, but they're not accidental. Think about it. Even if people often say, is this just a habit or there's something more to this? And I see your question as like one version of that. Why would something become a habit in the first place if it didn't do anything for you? Like, we have a habit to brush our teeth, but hygiene really has its place and it's quite important. So it's not like we started randomly brushing our teeth and then continue doing it. Even when we're not consciously intentional, we're never that random. So if something became a habit, and especially if something sustained itself for decades, then that habit absolutely has to have a function. It's like saying I just have this organ in my body, but it's just there for no reason. Is it possible to stop pulling like cold turkey? Oh, I spoke about this a little earlier. Yes, but it's also likely that you will start again then. What if you were told that it's very unusual to have started later in life than, say, childhood? So most cases of hair pulling start either in childhood or in adolescence. There was a study that I read once. I forgot who the authors were because I read it a long time ago, where they did a kind of statistical analysis of when people started pulling and what the outcomes and additional diagnoses were. And basically they came up with two clusters. of clients, those that start pulling early in the childhood, and then those that start pulling in the adolescence. The older you get, it is less likely that you will start pulling, but it is not impossible. And it doesn't imply anything particularly, bad in terms of prognosis. So it's quite often actually the case with other mental health issues. For example, I don't know, schizophrenia. The older you are, the less likely you are to get it. Basically, adolescence is the high risk sort of area for that, and then the older you get, it's less likely. But it does happen sometimes. Just because something is not likely doesn't mean that it's impossible. I've never been diagnosed. Can picking at split ends be a form of trichotillomania? Yes, it can be. But since I don't know you, I cannot say that whether or not it is that. Okay, so I think this would be a good time for us to stop since we've been at this for 2 hours and I'm in dire need of water. So I will see you in March and we will be talking about triggers, how to recognize them, how to identify them, and what to do with them. And then by the end of the week, I suppose you will receive the resources that I will send, the guided meditations and exercises. Enjoy, practice, explore, and I hope to see you in March. Have a nice evening. Thank you and bye.